Wickham Striae. The term Wickham Striae was coined by Louis Frederick Wickham in the year 1895 and corresponds to fine white or grey lines or dots seen on the top of papular rash and oral mucosal lesions of lichen planus, also called lichen ruboplanus, rubor, red. These are fine white lines of Wickham Striae seen in lichen planus, fine white lines. Pathogenesis. Various pathologic changes have been cited for formation of Wickham Striae. The first theory cited by Darrier in the literature attributes the appearance of Wickham Striae to increase in the granular cell layer in the epidermis. Sumerly gave the explanation of focal increase in the epidermal activity for the formation of striae. A third pathologic factor suggested by Ryan for formation of Wickham Striae is lack of dermal vessels in the area, which act as a contributing factor. The histologic confirmation of Wickham Striae can be done by India ink staining, in which the ink is retained on the stratum corneum. Clinical appearance. Wickham Striae are seen as fine white or grey lines on top of purple papular skin lesions of lichen planus. Wickham, while originally describing them, noticed that these striae did not correspond to the scale on the surface of the papule, as the striae were present on the non-scaly lesions too. Similarly, it was observed that Wickham striae were noticeable on the lesions on which the scale had been removed. It was, however, not been described in literature that at which stage of evolution of lichen planus the Wickham striae first appear. Wickham striae are noticeable in the mouth lesions also. In oral cavity, the Wickham striae appear in tree-like configurations or in the form of a lacy network, usually located bilaterally, and are seen with greater frequency on the buccal mucosa. These lesions can also be observed on the lateral margin of the tongue, gingiva, and lips. Wickham striae are of special significance in the diagnosis of erosive form of oral lichen planus, as this form may undergo malignant transformation. Identification. On skin, it is easier to spot Wickham striae if a thin layer of oil is applied to the surface of the top of the papular lesions. The handheld dermatoscope with a fixed magnification of 10 helps in the clinical confirmation of Wickham striae. It discretely shows the reticular whitish pattern of striae along with capillaries surrounding the striae as radial, horizontally oriented red lines or red dots. The recognition of Wickham striae by this technique has especially been found useful when psoriasis lesions coexist with lichen planus, since both the diseases present with superficial scaly papular plaque-type lesions. For beginners, it can be confusing. In such cases, presence of Wickham striae is considered to be a pathognomonic sign of lichen planus. Dermoscopy is a well-recognized tool for identification of Wickham striae by Indian authors also. In conclusion, Wickham striae is an important diagnostic sign of lichen planus and should always be looked for when confused or lesions coexist with similar scaly dermatosis. A comprehensive discussion of Wickham striae.